Nearly 50% of U.S. adults have high blood pressure, but fewer than half of adults have it controlled.
Hypertension is one of the most prevalent conditions that we see in this population, and so that's where we really saw the need in the community.
Barriers to hypertension management for our patient population can vary from cost of medications, education to understand why it's important, especially if they don't have symptoms of high blood pressure.
Target BP helps healthcare organizations improve blood pressure control by providing professional education resources, quality improvement tools, and annual achievement awards.
We've used the Target BP resources in several different ways, not only for the patients, but also for our team here. We've used them to help educate not only the providers, but also the medical assistants when checking patients' blood pressure.
So tools that have been very, very helpful for all of our staff is patient positioning poster for taking a blood pressure at home. So we now have those in all of the rooms, and it serves as a great reminder for staff to make sure that patients are positioned properly.
We had one medical assistant. She'd been working as a medical assistant for about 20 years. She's like, nobody ever told me this. No, I've been taking blood pressures wrong for 20 years.
Another pamphlet is in multiple languages, so of course English, Chinese, and also Spanish. And it shows the best tips, healthy eating, lifestyle, how to best measure your BP.
And then we typically print off the resources for patients as well so that they know how to adequately check blood pressure at home.
When patients start sending results into the clinic, the nurse will take that information, have communication with the provider. It's just stimulating more communication on a frequent basis.
But Target BP is really about like the whole health center. It starts even at the front desk, to the call center, to our dietitians, our pharmacists, our medical assistants, our nurses. Really everyone involved in the patient's care plays a role when it comes to Target BP.
Patients are thrilled real time in a week or two that they can see that their lifestyle changes or their med changes are making a difference.
In the past year, we've seen an increase in well-controlled blood pressure from 72% to 80% of our population.
We were about 53% hypertension control and improved that to 80%. It's been great for everybody.
Join the growing Target BP community to improve blood pressure control for patients nationwide.